So we'll move on to the next question.
Hi ma'am, I am Fauzia, doing BTech in KMA. I have a doubt. Sometimes most of the girls do have painful periods. Is it right to take painkillers for every month?
For these painful periods. Okay. I think this is one of the commonest problem that our young girls are
this is also one of
facing,
the common problems, dysmenorrhea as we call it. And dysmenorrhea is of two types actually. We call it primary dysmenorrhea and a secondary dysmenorrhea. Primary dysmenorrhea is actually very benign kind of a thing. You don't have any problem. You get your pain during the first or second day of your periods and it just goes away. Okay. Secondary dysmenorrhea is usually associated with some kind of a problem with
underlying diseases.
Underlying disease of the uterus and the ovaries or something like that. And so it needs to be diagnosed and treated at the earliest. So how will we know whether you are having primary dysmenorrhea or secondary dysmenorrhea? So if you are having painful periods, it means that you have to have some kind of an analgesic, usually an NSAID. That's what we usually take. If you have pain anywhere, you don't go to the doctor, you just go to the pharmacy and get a Dolo or some kind of an analgesic and you just pop in.
Yeah,
and usually the pain subsides. Okay. But you should not do like that. I'm not advising to go to the pharmacist and taking. That's what
the usual trend.
That's the usual trend. But this NSAIDs, which is the first line of management for dysmenorrhea, usually takes care of the primary dysmenorrhea kind of a thing. Okay. And so there is no problem in taking NSAIDs, that is the analgesic drugs, for the first 1 or 2 days. That is, you take it 6th hourly or 8th hourly depending upon the severity of your pain. So I don't think there is any problem in taking unless you are having gastritis. You're having gastritis or
there are more chances with NSAIDs. Okay.
But if you're taking the medicine for a long time, then it causes problems because it reduces the prostaglandins and can cause renal impairment, things like that.
Okay.
So for 1 or 2 days,
that means if you're taking it a stretch.
Yeah, for 1 or 2 days it's not a problem. But in secondary dysmenorrhea case, the pain starts much before the periods. Even 1 week before the periods, the pain starts, and it will be a dragging kind of a pain. It increases during the periods, and totally the pain will be there for 1 or 2 weeks. And so the girl would be really very much distressed because of the pain. And in such cases, you need to consult a gynecologist to see whether there is any underlying pathology, like most commonly endometriosis or pelvic inflammatory disease, that is infection of the uterus or let's say, and you have to identify the problem and get the appropriate treatment which has to be given.
So a girl with a dysmenorrhea, so like when do they have to go and meet a doctor?
Yes, if the girl is having painful periods and it's not getting relieved by taking simple analgesics, definitely she has to consult a gynecologist.
I mean, doctor, my doubt is like how many days, like how many months they can wait, or like on a regular basis.
Primary dysmenorrhea is very common. Okay. In girls who are not married, actually, it's very common. Once the ovulatory phase starts, that is after menarche, for 6 months there won't be any dysmenorrhea, and after 6 months, once your ovaries start ovulating, you tend to get dysmenorrhea. Most of the girls tend to get dysmenorrhea, and it's not a pathological problem. It's very common, and if it's distressing you, you can't do your daily activities, you can't go to school or college, definitely you can take analgesics. That's not a problem. But if it's getting relieved in 1 or 2 days, then there is no need to consult
consecutively how many months you can take, like with every period?
Every cycle you can take. No problem. You can take it in each cycle.
To say it's a secondary dysmenorrhea,
it's not. It will not get relieved by simple analgesics. You won't get relieved. You may have to go to the hospital, get injections. You will have very severe pain, which is not relieved by.
So other one is they'll get relief with the analgesics. Right. Okay, doctor. Thank you.